अतिथि श्रीमती अनुप्रिया पटेल जी हमारे मध्य विराजमान हैं। सामाजिक न्याय के प्रति आपकी अटूट प्रतिबद्धता और अद्वितीय समर्पण सभी के लिए एक अनूठा उदाहरण है। आप न केवल महिलाओं और युवाओं के लिए बल्कि समाज के हर वर्ग के लिए आदर्श हैं।
In 2016, at the time of assuming the charge of Minister of State for Health and Family Welfare, Ma'am was the youngest minister in the cabinet. Her empathetic approach and innovative policy interventions have made her popular grassroots leader. We are honored to have her with us today. May we now humbly request Ma'am to kindly address the gathering and bless our students with her inspiring words.
Our guest of honor for today, Dr. V.K. Paul, Member Health, Niti Aayog, Dr. Sunita Sharma, Director General Health Services, Dr. Sarita Berry, Director of Lady Hardinge Medical College, Dr. Anju Seth, Principal, LHMC, and Dr. Harish Pemde, Medical Superintendent of Kalavati Saran Children's Hospital, all the HODs on the dais, faculty members, staff, parents, friends from the media, and all the awardee and graduate students today. A very good morning. It is my esteemed privilege to join you all today on this momentous occasion, the convocation ceremony of Lady Hardinge Medical College. And to begin with, I extend my heartfelt greetings to everyone here on this very, very special and memorable day. Lady Hardinge Medical College, as speakers prior to me have also stated, it's one of the oldest medical institutions and it has a very distinguished status. It's older than our parliament, Rashtrapati Bhavan, and it has been a very long journey for this institute for 110 years. And over all these years, we've seen the institute evolve academically. And the institute has a unique character which it has retained of admitting only women students in the undergrad courses, but we also see equality of gender in the PG courses. Government is committed to upgrading this institute, and with time, there has been a lot of infrastructural upgradation also. I heard your director, Dr. Berry, speak about the annual report, your academic achievements, and it really speaks volumes about the commitment and the dedication with which the entire fraternity here is working. So I want to congratulate all of you for that. Today, we'll be awarding undergrad degrees to around 240 students and specialty degrees to around 200 students. And with this, the nation will get some more skilled and competent professionals who are going to shape the future of healthcare in times to come. And I was very happy to learn that this is the batch of students who have studied and learned and served during the most difficult times, the COVID-19 pandemic. So I'm sure you have emerged stronger with that experience, and that is really going to help you in life. Why I say this is because today is your graduation day. So you're all excited, your academic journey is completed, but now begins a new chapter of your life. And that is about facing the real challenges. life after graduation is a different journey altogether. There'll be ample opportunities for you, but there'll also be real life challenges. And there'll be so many unexpected twists and turns that you will be expected to navigate through. And we are all confident that the knowledge you've gained here, the skills you've mastered, the lessons you have learned, everything will help you in navigating those challenges. It will help you in your personal growth, and it also help you in paying back to the society. And now is the time to pay back to the society, to serve the nation. Today is a very special day for you. We are all here to give you our blessings, our greetings, but at the same time, I would like to acknowledge the efforts, the sacrifices, the support which you've received from the entire society. It's your families, your well-wishers, your friends, your teachers, and so many people who have contributed in the successful pursuit of your academic journey. So today, when you're going to be the future healthcare leaders, doctors, this nation has huge expectations from you. And I want to say to all the students who are present here, that medical profession is a unique blend of privilege as well as responsibility. So while you're going to be highly regarded as a doctor in the society because you will be able to, with your skill and knowledge, your competence, alleviate the sufferings of a patient and promote his overall well-being, the society also expects you to uphold the highest ethical standards. And while doing that, you serve this nation, especially those who are underprivileged and who come from the weaker sections of the society. That is the expectation which this nation has from you. And I'm sure with the values that you carry from this institute, you will all grow into compassionate healers. Today, my dear friends, when we gather on this convocation day, I would also like to say that we have a big vision for this country. Prime Minister of India, Shri Narendra Modi ji, he has appealed to the nation, let's come together and transform India into a developed nation by 2047 when we complete 100 years of our independence. We've long carried the label of a developing country. We no longer want to carry this. We want to be a developed country. And health directly contributes to this goal. Only a healthy nation can be a developed nation. And when you're going to move out into the world, start practicing, you must also have a fair idea about what is the healthcare landscape in India looks like today. Since independence, we've had several governments. Different parties, different coalitions have ruled this country from time to time. And every government has made some contributions. But I want to take you through the profound transformation that has taken place in the past 11 years of our government. What does the healthcare landscape of India look like today? How have we worked towards changing this scenario in the past 11 years? That is very important for you to understand. So the first and the most important step that we took was introducing a new national health policy. For 2 decades, nobody thought of revising the earlier policy. And it's important to understand, why did we need a new health policy? We needed it because healthcare has evolved with time. Healthcare today does not only mean curing a diseased patient. Healthcare does not alone mean preventing diseases. So for years, this has been the approach with which we were working in this country, that healthcare means preventing diseases and curing an ill patient. The world has moved ahead. Things have evolved, and so has healthcare. So with new national health policy comes the new definition of healthcare. And today, healthcare is a comprehensive approach. So when we say healthcare, it means preventive, promotive, curative, palliative, and rehabilitative. That is healthcare, with prevention being the most important aspect of healthcare. As doctors, when you're going to practice, you will also realize how significant preventive healthcare is. And in India, we are working with this comprehensive integrated model now. That's the guiding statement for us. And what is it that we aim to achieve? Globally, when you go, you will find that people are discussing universal health coverage. What is universal health coverage? Can we achieve it? India is a huge country, 142 crore people. Such a huge nation. And we are talking about universal health coverage. What does it mean? We want to ensure access to quality and affordable health care to each and every citizen. Is that really a realistic target? That's the question that comes to your mind. And this is a government, I very proudly say, which believes in making the impossible possible. How? With the right kind of approach, with the right kind of policy, with the right kind of strategies. So when you say that you want to give every citizen in this country quality health care, affordable health care, how is that possible? It is possible with a strong political commitment which this government has today. It is possible by increasing government funding, government expenditure on healthcare, which we are doing today. The budget of healthcare is close to 1 lakh crore. It has constantly been on the rise. Our national health policy says we must spend 2.5% of our GDP on healthcare. And I'm very happy to say, what we incorporated in our policy, we started following and adopting it. Today we are already close to, the policy came in 2017, today we are already close to 2% of GDP expenditure on healthcare. It is important to address the social determinants. You watch on television, you read in the newspaper, this government is giving housing to the poor. This government is running Clean India campaign. You may also be doing it in your own campus. This government is running programs like Jal Jeevan Mission to provide clean drinking water to India's citizens. This government is running Ujjwala scheme to provide clean cooking fuel to our women. What is all this? The quality of water you drink, the kind of settings you live in, hygiene, sanitation, everything contributes to our health. So addressing the social determinants is very important, and our government already started efforts 11 years back to attain the same. Universal health coverage can be achieved when we strengthen the healthcare infrastructure in the country. We are strengthening primary, secondary, tertiary healthcare infrastructure. You will get an opportunity to work in some of those primary healthcare centers in the rural areas. You will see what a wonderful job they are doing. They have transformed the primary healthcare services. It has been revolutionized because 12 different services are being provided at the grassroots level in a rural setting, in a small primary healthcare center, which we call an Ayushman Arogya Mandir today. This is a government which has increased the number of All India Institute of Medical Sciences from 7 to 23. And this is a government which is filling up the critical gaps in the secondary healthcare institutions with the schemes like Health Infrastructure Mission. And in India, we often talk about the shortage of doctors, and especially the specialist doctors in the hard to reach areas. So has the government thought of it? Yes, it has. You also read, you also learn, you also hear, number of medical colleges has gone up. So we have expanded the medical education infrastructure as well, so that there are more doctors in future. We don't have a skewed doctor population ratio. There are as many doctors as we need as per the WHO norms for the population. That is the kind of arrangement we have done. So this is how Government of India is working today. We are encouraging our institutions and our medical fraternity to adopt digital healthcare solutions. Technology and innovation is the way to go now. Why? Because it improves the patient outcomes. You hear of schemes like Pradhan Mantri Ayushman Bharat Jan Arogya Yojana. Government is giving 5 lakh rupee health assurance to every poor citizen in this country. You just imagine the scale. 55 crore people in this country who are the bottom 40% of the population, means economically weaker section. Today, they have a health cover of 5 lakh rupees, which means free of cost treatment for 5 lakh rupee for this 40% population. And not alone this 40% population, even the frontline health workers, the senior citizens of this country who are aged 70 years and above, and the gig workers. So government has covered all of this and providing them the world's largest health assurance cover of 5 lakh rupees free of cost treatment. You hear of Jan Aushadhi stores, Amrit Pharmacy. What is it? In our country, there has been a large section of people who do not have money to buy medicines. People do not have money to avail medical treatment. So how can you attain universal health coverage when you have people who can't buy medicines, who can't go to a doctor, who can't seek a treatment? Government took this responsibility. That is why the health assurance, that is why the discounted medicines and quality medicines. The out-of-pocket expenses is reducing, it has come down. People don't have to spend from their pocket, government is making all arrangements. And we went through the worst tragedies in the past 100 years. The biggest health crisis, COVID-19 pandemic. The entire world was shaken up. And People used to be discussing how will India manage it? Such a huge population, people living there is great density, people living so close to each other. What will they do? India set an example by running the fastest and the largest vaccination program, administering 220 crore COVID vaccines with double dose, booster dose for all our citizens, and the entire world was surprised with how India has been able to manage the pandemic. So that is how we are trying to take the country towards the goal of universal health coverage. And my dear students, for us, healthy India, health for all, these are not slogans. It is a moral commitment of this government. It is a moral commitment. And we consider expenditure in healthcare as the most productive investment for building a developed India. Like I said earlier, there can be no developed India without a healthy India. And healthy India needs so many efforts. But this is the government's efforts. Health is a shared mission. Health is not alone the responsibility of government. Health is a collective agenda. So everybody needs to come together, whether it is the policy makers, the legislators, or the medical practitioners, or the media, everybody, even the community. And only when we consider health as a shared mission can we really create a healthy India and contribute to the larger mission, which is a developed India by 2047. What is your role? You're the future leaders of India's healthcare landscape. What is your role? You have a big role to play. So many of you can actually engage in research addressing the unique health challenges that face our country. Many of you, in fact, I would say all of you, should adopt more and more digital technology and innovations to expand access to healthcare for our citizens. You can participate in the government initiatives and be an agent of change. There are just multiple ways in which you can play your part. And we all believe in your potential. We are confident you can be an agent of change. So today we are here to appeal to all of you that you carry forward the proud legacy of this institute, where you have spent so many years and you serve this nation with distinction. We are all hopeful that each one of you who leaves the campus is going to be a compassionate healer, contributing towards a Viksit Bharat by 2047. And with this, I once again extend my heartiest greetings to each one of you. And I do hope that you all succeed in all your future endeavors. Thank you very much. Jai Hind.
आज के कार्यक्रम की मुख्य अतिथि श्रीमती अनुप्रिया पटेल जी के इस बहुप्रतीक्षित उद्बोधन के लिए हम उनका धन्यवाद करते हैं और हम आभारी हैं कि उन्होंने हमारे छात्र एवं छात्राओं को आशीर्वाद दिया और वर्तमान और भविष्य में समाज के प्रति उनकी जिम्मेदारियों के लिए सजग किया। आपका हार्दिक धन्यवाद इस दीक्षांत समारोह की गरिमा बढ़ाने के लिए और इसे यादगार बनाने के लिए।